All right, we are live again and still and some more on day 18 of our, it feels a little bit like a marathon, just a little bit. Every day going live with the Sage Circle Alliance Charter Member Drive and just Awareness Drive and Uplift Drive and Get Happy and Be Celebratory Drive. That's what we're doing. So my name is Meryl Fury. I am a registered nurse, and I am one of the two co-founders of the Sage Circle Alliance. My other half, who is not here today, he is out with family at, I believe, a graduation, is Paul Chatlin. He is founder and president of Plant-Based Nutrition Support Group, which is in Michigan, really, and on the internet, of course. And I am president and CEO of a very similar organization called Plant-Based Nutrition Movement. Together, we have co-founded the Sage Circle Alliance, which is all about uplifting and amplifying the voice of the movement for saving, human health, animal health, broadening animal compassion, as well as really paying attention to the health of our planet in every way that we possibly can as individuals. So that being said, with us today, we have VLynn Hawkins, who is a co-founder and I'll let her introduce herself, but one of her business, she's a serial entrepreneur is what I would call her. And she works to help amplify the voice as well. She's one of our founding members for Sage Circle Alliance. And Karen Ranzi is also one of our founding members. And you know what? This is going to be such a juicy conversation. Karen also works with family health and wellness, and particularly with children, which are subjects near and dear to all of our hearts. So I'm done blabbering. How about, you know what I would really appreciate, because I did not do either one of your introductions justice. So how about, Karen, you go first, introduce yourself and say exactly what goes on with you in your neck of New Jersey. And then VLynn, you go. And I'm going to go off camera for just a minute.
Okay. So I'm Karen Ranzi. I have been a vegan health coach since 1998. I'm an internationally acclaimed speaker, having presented worldwide for over 25 years in countries like Russia and Costa Rica, Australia, many other places, the UK, all throughout the United States. And it is my mission to spread the plant-based and raw vegan message so that we can have healthy children leading to healthy adults. I'm also a speech and language pathologist and accredited feeding therapist for over 43 years, having graduated with a master's from New York University and specialized for 20 years in an autism continuum program in the public schools. And I have specialized in raw vegan nutrition, working with women with weight, hormonal, and gut health issues, and also raising the healthiest vegan families. So I have worked with a lot of parents and also with their children directly with conditions like autism. Even though there's many wonderful things about autism and we can celebrate it, many of these parents have come to me for help with some of the symptoms, wanting to turn them around, and have found success with whole plant foods and raw foods and other lifestyle factors. So I really delve into this with my clients, with my women who I work with. And I also direct the Vegan Coach Certification course, where I help others who are aspiring vegan and raw food health coaches to get out there and help others. So I'm passionate about this topic. I'm working on it in many, many ways, and just so excited to be with a wonderful group of people who are also looking to spread this plant-based message for our health, for the animals, and for saving our planet.
Thank you,
Yes.
Karen. Yeah, thank you.
Yeah.
VLynn, introduce yourself.
Thank you, Meryl. Karen, I am so with you on all fronts. We need so many more clones of you to add to the voice and the passion by which we all bring to this project. I am one that's just as passionate. My background way back was in commercial real estate lending. And from it, I garnered a lot of the skills and abilities that I bring to the table today after being certified as a digital marketer in 2013 and having been the Dean of Social Entrepreneurship for Directions University. And, you know, in my early years, I was a fitness enthusiast. And that's putting it lightly. I was majorly involved in an extreme athlete. I was a fitness instructor for 20 years. I was an amateur bodybuilder, and I taught classes from kids aerobics to seniors aerobics. And a runner, I've run marathons and countless 5Ks and 10Ks. I was an organizer for fundraisers in some of our athletic arenas, even to the extent that I did a fundraiser one time that I invited celebrity guests. And it was a 4-hour aerobathon raising money to help clean up after Hurricane Hugo. And specifically, my mom was a pastor at a church in Charleston that got devastated by Hurricane Hugo. And not only did we raise money, but we had a truckload of goods and clothes and food, and would not have been able to happen had I not had the wherewithal and done that fundraiser. But as I grew older, my body started talking to me. I've always been athletic, and I took to cycling and had to go extreme there too, with cycling, 100-mile bike rides. Century bike rides were my favorite. And my regular training ride several times during the week, and especially on the weekends, were on average 50-mile bike rides, 25 miles out, 25 miles back. And doing them in record time. I was just really enthralled in what that gave me as far as what I could see in nature and what I could do, feel, and think spiritually. And as I came out of the corporate world and went into business for myself, I became a business coach for women entrepreneurs, and that grew into kind of identifying the women that were being attracted to me. And I'm telling this story because it took me a long time to really figure out who my real audience was, and to determine that they were women entrepreneurs, women in business, women who wanted to get their message out, to share their passion, to help more people. And lo and behold, Kathleen Gage, my business partner, and I connected at an event where I was participating to help the organizer of the event to do just that, get the message out, get the word out, and to help educate and amplify the voices of those in this arena, the whole food plant-based movement. And today we are all about elevating and amplifying the voices of those who are part of this community, because we know that there is so much more to do. There are so many more people for us to reach. And in particular, our children are the ones who I believe, and I have to find a different word for it, but suffering is the word that comes to mind. Impacted is another word, and we can do something about that. And the way that we do it is by coming together, by collaborating and co-creating things that will reach into these places and spaces where the parents and educators and caregivers and those who have an affinity, group leaders who actually are looking for ways to further educate their youngsters. And in doing so, this message about food, about nutrition, about the 6 pillars of lifestyle medicine are missing from what children are being educated in, on, and about. And it needs to change. Where they find all the video games about killing people, they need to start finding video games about healthy eating and exercise and connecting to exercise together, even if it's virtually. I was thinking the other day, and I'll wrap this up, but I was thinking the other day as I was doing my walk, I was like, it used to be that you would see children outside playing. They would have their chalk and drawing hopscotch on the pavement or out in the street, and if you're in a cul-de-sac, that's all you saw on the street. And today you hardly see children outside at all. You not only don't see them outside, you don't hear them in their own backyards. And yeah, we've got a couple of issues with the pollen count and the this and the that. And we all know that it is the food system that is a major contributor to all of the other things that we are experiencing. And I want to help make a difference as it relates to the human frame, our non-human relatives, and the framework within which they live and can live better lives. And our planet, and I shudder to say that what we do in our human health trickles down to make that positive effect on the planet. And it's time for us to do something. I am so excited to be a part of the Sage Circle Alliance, where I believe those who are also a part now and will become a part of the organization will be those who have an affinity of moving the message forward and helping to educate and empower those who want to be in this space of healthier all around. So thank you for that.
Thank you. Thank you.
Yeah. I
Yeah.
just also want to say that my kids, I feel, were like the last decade of playing outdoors. And I'm so grateful that my kids were outside with the neighborhood kids playing manhunt and tag and riding their bikes together. And like what you just said, VLynn drawing on the ground with chalk and playing hopscotch.
And Jackson, yeah.
Yeah, I mean, that was in the 90s. But like after 2000s, I didn't see it anymore.
Yeah.
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 Like
I mean,
when my
there's
kids were teens, it wasn't even a thing anymore to be outside. Like kids were already just indoors on their tablets, on their computers. There wasn't the communication anymore.
right. There's other causes for it too. The tablets and the digital world, right? The video games, that's certainly one big chunk of it.
Yeah.
But then we also have neighborhoods where it's not safe for children to run and play and be outside for any length of time, really. And then, I was talking about this yesterday, this little girl that I met who did the experiment with the eating the standard American junk food snack thing every day. And her whole observation, so brilliant at 10 years old, for her to realize that when she would eat poorly, she had no energy to go outside and play. She had no desire. All she wanted to do was just come home, flop on the couch, and watch TV. So there's a lot of impact and a lot of things going on in our environment that have children with less than adequate energy and opportunity to run and play and be outside, for sure.
Yes, and I do agree that a big part of it is what they're putting into their bodies.
Yeah.
So, and they don't understand it because sometimes it's cumulative. It's not happening right away. And it takes a certain amount of toxins going in to build up and build up and build up. And then they're all of a sudden really sick, or they just can't function properly.
Yeah. Yeah. So Karen, you've been doing this kind of work with children for a long time where you help them detox, basically using healthy food as okay, this is total nerdy word, but it's the only word I have. To almost like chelate the toxins out of their body, to pull the toxins out, right? Tell us a little bit about what you've seen when you're working, maybe a case study almost of a child you've worked with or a family you've worked with and how it went.
Yeah. Oh, there's so many of them. And I just love doing this work because when the parents are motivated, there's so many wonderful things that end up happening to the whole family. Because it usually has a rippling effect. When the parents see this happening to the child, they get even more motivated. But just an example of a recent mom, there's actually even two with kids different ages, but one mom, a single mom with a 7-year-old nonverbal daughter with autism. The daughter was having violent episodes, reasonably so, very frustrated, not being able to communicate, not really looking at the mom or interacting in any way. And the mom came to me because she heard a talk that I did on Chef AJ. And she contacted me and she said, I'm not really sure what I'm doing, but there was something about your talk that drew me to working with you. And I really want help for my daughter to see if changing the diet can be helpful. Now, for her, she was already plant-based. She was vegan or vegan at home anyway. But they were not eating healthfully. It was mostly processed packaged stuff loaded with MSG, monosodium glutamate, which is, there's a lot of hidden labeling in foods that most people are unaware of, is actually an excitotoxin that excites the nervous system. And so she didn't understand that. And all day long, they were, she wanted quick foods. She's a teacher. Her daughter is in school, and she just didn't really have a whole lot of time. And so these foods became their diet. And when I pointed this out to her and gave her an article that I had written about all of the hidden MSG excitotoxin labeling, she was shocked because she had thought that when she transitioned to vegan, which definitely for many people, still good to transition, but not to stay there for too long. And her daughter was not making any progress in any ways, and especially behaviorally. The mother was very concerned with how to deal with her, both at school and at home. And once we started working together and giving her meal planning that was more fresh, whole, plant foods without all these preservatives and hidden MSG labeling, and once she saw all the names of the hidden ingredients that she could look up, she totally perked up and realized that she could definitely start making positive changes for herself and for her daughter. And one of the first things that most people notice, whether it's autism, whether it's emotional issues, whether it's attention deficit, whether it's illnesses, childhood illnesses, childhood illnesses are just raging like never before. childhood leukemia, childhood diabetes. It's just, there's so many areas that parents are so frustrated today. And in this situation, when she started just even bringing in an abundance of fruits and vegetables in simple meal planning, and we went in steps, we didn't get rid of the packaged junk all at once. We did it in steps so that it would be more manageable for her and that she would know how to make things quickly and plan ahead. And that's what she started doing. And as we progressed through the steps, over a period of 1 to 2 months, she started to also see the changes in her daughter. The first change she saw was in the digestion. Her daughter, who had been constipated, was now having like 2 to 3 bowel movements every day quite easily. And she was so grateful because her daughter was in pain,
Right.
went to the bathroom.
Oh.
And now, and this is true for a lot of these kids, is that suddenly their digestion is working. And that's the first part. That's the first part of healing. And this happens for adults as well. It's often the first thing that I hear from them. Then after that, as her digestion improved, and we know that the gut is very much linked to the neurological system in the brain, other things started happening. So the next thing was behaviorally. And what was it? Her daughter became calm. Her whole system calmed down. And the mother was telling me that her daughter is no longer having these violent and aggressive episodes, that she was calm, that she was starting to interact with her, just even visually, making eye contact with her, which was not happening. And then the next part of what happened, and this was all in a period of 1 to 2 months.
Okay.
And her daughter not only started looking at her and listening to her and engaging, but this child for the first time started to speak.
Wow.
And that's where it totally blew the mom's mind.
Mhm.
She was
Wow.
like, I cannot believe this. I mean, I have this testimonial up on my YouTube channel with this mom talking about what was happening with her daughter from these really positive, whole food, plant-based, very high raw, not completely raw, but whole foods, all whole foods, and no oil, no salt, and lots of fruits and vegetables.
Mm.
And so the daughter started speaking. It started with her answering yes, no questions. When her mother asked her something, she started to say yes and no. And then she started to say mama for the first time.
Oh.
So this mom was very, very teary. I
Oh.
showed a couple of my friends before I put it up on my YouTube channel. I showed a couple of my friends this video and people were crying. They were like, this is just so powerful. But still, I have it out there. And it's like, I was working with the autism community in the public schools for 20 years. And there were only a couple of parents who really believed. I did some talks in the school because after 20 years being there, they trusted that I knew my stuff because they knew what I was doing with nutrition. And they brought me in to speak, and some of the teachers and the therapists actually took my programs. So there was this growing positivity that nutrition should be looked at for these kids, but it wasn't really made aware to these families.
Right. Still not.
I was able to make some of the families who I worked directly with conscious of it. And there were a few families who came to me for the nutrition coaching, but it needs to be broadcast so much louder.
Yes. You know, just not too long ago, you guys will hear me say this multiple times over the course of this month and beyond, but I get to work with children, you know, so here's my t-shirt for today.
And ate vegetables. That's
Right.
cute.
Born in 2020, so it's a little dated, right? But okay, it's still the same thing. And so just not long ago, we've started, we collaborate with other nonprofits, and we had the opportunity to go to a school. I personally went to a school to do a presentation to the staff at the school, and the staff at the school were talking about how they have a growing population of children that show signs of autism or are diagnosed with autism, as well as some other neurodevelopmental issues and things like that. Well, I went to this school thinking that I was going to be talking to people who understood the plant-based foundation anyway. I got to the school, I started to do my presentation, and literally had people pushing back because fruits and vegetables can't possibly do that, or because that is shaming to suggest that fruits and vegetables could be the answer. That is shaming to the family. It's dangerous, they told me, to say what I was saying. I was blown away. Just like you're saying that, at least you had 20 years experience and they thought you were safe, right? So they let you back in to talk to the families.
Yeah.
It is devilishly hard to get this message out without somebody taking some personal offense or
That's
pushing
right.
back and saying, no, they need their, all these medications, which, okay, maybe they do to a point, but there's certainly no reason to not give them fruits and vegetables and whole grains. There's no reason to avoid that.
Right.
It can only help unless
That's
they're allergic to it or something, right?
Yeah.
Yeah.
I did everything in my power to get the word out about this. I wrote, and I took 7 years writing this book, Creating Healthy Children Through Attachment Parenting and Raw Foods. I didn't even put vegan on the cover.
You probably
Even
would
though
have ended trouble.
I wanted to put vegan on the cover, but so many of these people just have a negative view of vegan that I just put raw food on the cover because sometimes people are enticed by, oh, raw food, like maybe that could help me or my family.
Right. Sounds like
But this has vegan throughout the book. Inside the book, it's all about plant foods. It's all about plant foods. We have to go back to nature.
Mm-hmm.
We have to go back to our roots of what children were initially brought up on. They weren't brought up on potato chips.
That's
They
right.
weren't brought up on hamburgers. So
We have the issue of those children who were brought up on potato chips and hamburgers. This is a whole new space for them. Now, their parents weren't, but their parents have found this as a self-proclaimed easier way to manage feeding children, when actually, if they really knew the truth and how damaging it is, I think they would have thought, they would have had a second thought.
Mm-hmm.
They would have looked for something different. Well, if this is the best way, there's got to be an easy way to do this the best way. And they weren't offered that because that's not what they were seeing on television.
That's right.
That's not what they were hearing from friends. That's not what they were hearing from their doctors. How often have we gone to and taken our kids to the doctor and never had the question asked, well, what are your kids eating?
Right.
Never.
I mean, even to the point where the WIC program, and I'm sure everybody has heard of the WIC program, they have just in 2024 begun the transition of the program to add more plant-based opportunities that mothers can or parents can get for their children being a part of the WIC program. But they had the sugar cereals, they had the milk, even after the milk commercials were off television, because that's what they knew, that's what they thought was healthy.
Well, that part though, VLynn, I'm going to interject right there. The WIC program, along with the SNAP program, these are government funded programs, right? And those programs are actually overseen by the U.S. Department of Agriculture. The USDA has its mandate, which is to make sure there's a steady supply and a ready demand for the farmer's products, and to determine the nutrition, best nutrition for American citizens, right? So their missions, those two missions are at odds, because you can't support, it's hard to support both the seller and the purchaser. You can't, those are cross purposes, right? So
in advertising or in promoting.
Right,
Yeah.
making them available and keeping the price low and whatever it is, right? There's all this confusion, all that is at conflict. So for the WIC program, the sugar cereals and all that has a lot to do with making sure that those foods that the farmers produce have a ready market.
Yes, the WIC program.
The WIC
for
program, the SNAP program.
infants and children.
Yep, that's what a lot of that is. It's a government, it's our government at work is what that is.
An open door from the government to the foods that, quite honestly, are detrimental to our children's health.
Yes,
And
population, yes.
And they are just getting to the point because two things. One, the incidence of health issues in children has increased to the point that they want to figure it out. They're trying to make people think that the balance is coming, where there's less of the detrimental foods and more of the healthy foods. However, they're not promoting that, so people don't even know. And when you don't know what's available to you, you don't look for it. And unless you know to ask for it, you don't even know it's available to you.
And I don't think they're going to push for it because there's no money in it.
Mm-hmm.
And money is there in getting healthy. Like once you get healthy, it's like you're in control of your health.
There's two things about that. And it goes back to, again, what they don't want you to know, because we were talking about this, came up yesterday too, in that when you're shopping the right foods, I think Rachel brought this up, and the school program, right? The state of Illinois, the first state that has mandated that plant-based options be offered for children in school, K through 12. And the schools that have outside of the state of Illinois, just random districts that have done this, have shown that they have not only helped improve the health of the children within their districts, but they have saved millions of dollars because the food costs are different and the food availability is there. So why not go in this direction? And the school districts that have had this happen have been able to flourish in other ways by saving these dollars. But again, it's not heard about. It's not talked about. People don't know about it, so they don't know the real advantage of making that shift. And then you're right. The money that goes to the production of the bad foods, I'll just say, is so much greater. There's so much push in that direction that the good stuff gets left out. It gets pushed down, and we're going to have to fight for it to be more prominent. And our fight is educate. Mm-hmm. Our fight is amplify the voice. Our fight is show up, be seen. And we're doing that. And, I've just got to say, we're inviting others to join us.
Yeah. And the fact that we're building numbers here, like that's why I was so excited when I met Meryl and we talked about, she talked about this group and growing this group. And there is voice in numbers. I saw it myself. When my kids were in school and I went to the PTA and they wouldn't listen to me. They wouldn't even let me come and do a talk. But when I got a number of parents in the PTA to join me, we went into the cafeteria and we asked for more plant foods in there. And we asked, even they had a hamburger, so we asked for a veggie burger, and we got it. We asked that the candy machine be taken out, that wasn't needed at lunchtime. They took it out, and it was because of numbers. I couldn't do it by myself.
Right.
So that's one of the huge benefits of a group like this, that we have more power. We have more power to go and ask for what we want and to get out there and educate.
Right. Right. Just listening to you both, really, like, okay, I'm having these emotional reactions over here. I'm having, like, my heart is swelling, I'm like, oh my gosh, this is so great. Because right now we are approaching, I think, we're closer now to a tipping point than we've ever been, with people realizing we cannot continue just to feed our children like this. We can't continue with diabetes on the rise, obesity on the rise, all of these lovely biomarkers, all of them out of whack in children. And so many, we talked about this yesterday also, but just, the reminder that the American Academy of Pediatrics now says it's okay for certain children who are struggling with obesity to either be put on weight loss meds or to have a bariatric surgery. It's crazy. It is crazy what we're doing. We cannot continue. Talk about an existential crisis. If we don't take care of the next generation behind us, we will die out, right? Talk about an existential crisis. So the idea that in the Sage Circle Alliance, we have the opportunity to bring people together from all across the country, and certainly across the continent. We do have people in Canada. And then, it could expand to all around the world. But even if we just started in the United States or on the North American continent, and we said, we are here to stand up for our children. We are here for that. That's just one thing. I mean, we can do certainly other things, but if we just started with that, we're here to stand up for our children. We are here to fight back against the constant marketing for garbage it's funneled into their little brains from the time they're born, right? The constant pushing of chemicals and ultra processed foods. Even now, I'm a big vegetable lover, right? And I don't eat any animal products myself, and not in this house at all. But even if a child ate meat once a week, it would not do to them what these ultra processed foods and chemicals and dyes and petrochemicals and all this garbage is doing to them. It would not.
Yeah.
So that to me is the power of numbers, like you're talking about, Karen. Having other people of like mind and like passion, like mission, we could make a difference for our children in this lifetime. We could do that. That is inspiring to me.
That's what I believe. And that's something I feel like I've been out there by myself for so many years. And it's exciting to know that people want to get together and they want to spread this message, and they know that it is time. That
Right.
we all know that we don't have too many choices.
Right.
That if we
Right.
don't do this, nothing is really going to happen.
Right.
That's right.
It's the sage question around, if anybody is going to do it, who's going to do it? The person asking the questions, the person who's right here saying it needs to be done. Well, thank you. Join hands with us.
That's
Lock
right.
arms. Let's go. Yeah. Yeah.
Come on, now's the time.
Yeah.
It is the time.
As
For
a
sure.
grandmother, I'm looking at, at age 20, my grandson, my oldest grandson, was diagnosed with type 1 diabetes. And it was devastating to all of us to have found that out, because no one in our family had diabetes. My mother contracted type 2 at an older age when she couldn't give up her little candies. But that's honestly to be expected. This is a kid who, as a kid, was eating pretty healthily, but to, all of a sudden wake up and, he's losing weight. Dark spots under his eyes, his legs were this thin. I said, something is wrong with you. You have got to go to the doctor. And the day that he went, he got a call saying, come back in now. Your numbers are such that if we don't do something right now, you're liable to go into a diabetic coma.
Wow.
And got to the doctor's office. They regulated him, got him started on meds. And for us, it was finding out, okay, type 1 diabetes, this kid's got to live with this the rest of his life. It changes some of the life options that he has in his future. Now wearing one of those detectors, and monitors, and he's giving himself injections every day. And the first few months were pretty strenuous for us. One, knowing what you go through when you're faced with something like that, denial, anger, you're looking at all of these emotions coming in all at once. How do you process all of that? So we had a lot of discussions during that period of time. But I look at that situation and I look at the child who, and it's kind of like one day you wake up and you look at this kid and they're like, you remember them as a little, this is the kid talking. I remember me as a kid being able to run around and do stuff and, roll on the floor, and I was doing this and doing that. And all of a sudden I wake up and I look like this little rubber ball. What does that do to the kid? And the kid, not really knowing what they're thinking, is thinking, how did this happen to me? But then they start looking around and they see other kids very similar and start thinking, oh, maybe this is the way I'm supposed to be. Because my parents aren't telling me anything different, and I'm still, whatever they're feeding me, I'm eating, because I don't even realize it's about what I'm eating. I just think this is the way I'm supposed to be. But what do you think would happen if children started learning what real health looked like and real healthy children looked like? Do you think that they might want to eat right, exercise, be more willing to get good sleep and drink water? I mean, that's what it's all about, right? What we don't know, we don't know. What we learn that makes sense, especially when it makes us feel better when we start doing that. We talked yesterday about the whole experiment. When we start experimenting with these ideas, the things that can happen. And it's one of the reasons why, Meryl, I really want so much to be able to be a support in the documentary that you're doing, because it's critical to have those stories of other kids who have done the experiments and able to speak to what they felt like going through it. And in retrospect, after it's done, what did I learn? What do I know now? Especially, what do I know that I can share with others? Right. And that is the best way to put in front of kids the idea of what a healthy kid looks like, and to put in front of them the educational piece of, how do I become a healthy child, not now that I know that I am not as healthy as I could be. Mm-hmm. And, with your podcast, Sage Talk for Wicked Problems, the SCA's podcast, being able to look at this as a wicked problem and know that there are solutions. Yeah. This documentary is part of the solution. Our conversation today is part of the solution. You out there, a potential charter member of the SCA that has a heart for children like we do, you're a professional in this arena, and you know that plant-based vegan lifestyle is something that could save a child's life. Join us in this conversation. Mm-hmm. Join us in the work that's ahead. We're looking for you.
That's for sure.
Yeah.
Yeah. You were talking about how a child would know, how would they know that they they woke up one morning and you're saying they're round, maybe kind of chunky little person, right? What I find in working with kids though is, first of all, we got to remember children can be kind of critical of each other. Kids can be mean, right?
Oh, yes.
Um, and so the children who are already struggling with their weight, or maybe, they may have other issues, rashes, or kids with alopecia, or, hair falling out, things like that. You can believe that some child has already pointed it out to them, right? Because the kids do
They don't
not,
hold back.
they don't, right? They're
Kids are blunt. They often want to attack.
Yes, they notice there's something different. They see it as like, that's odd, and they'll point it out, and then it can turn into bullying. So the children who are struggling with some of these issues definitely know that there's something going on.
Something's off. Mm-hmm.
Where I do see, and this has been an eye-opening experience for me this year working in this elementary school here in Wisconsin. And I've told the story, so I don't really want to bore people with it again, but the Reader's Digest version is, we started there in September. We've gone every month and taught the kids about healthy food, and we bring them full-blown meals for them to eat while we're having class, right? So it goes anything from pasta with marinara and zucchini chopped in it, to a salad bar, to eat the rainbow with every color, and five different fruits and vegetables of every color, and they taste them all. And we've done a lot of stuff, right? What has made, I think, the biggest difference for these children is, first of all, we're not trying to shame anybody or embarrass anybody. We're just giving experience. And if you don't want to eat that blueberry, please don't eat it. Don't eat it. Just like feel it. Push it, smell it. Okay,
That's exactly what I did as a speech therapist in the schools.
Yeah, you have,
because a lot of the kids had sensory integration issues.
right?
So we would even do art with berries. We would take strawberries, blueberries, raspberries, and I would bring in white paper, and we would do art projects. We would do visual things. We would smell it.
Yes.
We would, they would watch me eating it.
You know what? I've even told them,
ask them to try it.
What I tell them is, okay, it's just a blueberry. I want you to just stick your tongue out and just lick it.
Exactly.
If you don't like it, throw it away, right?
Yeah.
We always encourage them to be brave. But what I think this last time we went, and this blew me away, right? So the last time we went was in April, going again on Monday. In April we went, that was Earth Month, right? And the teacher for the classroom is just phenomenal. Love her to death. And she will build in her lesson plans around what she knows we're going to do. So I send her our topic, a week or two ahead, preferably week or more, 2 weeks or more ahead. And she can build in lessons around that. So we were working with Earth Month, and I had a connection to some rainforest stuff, curriculum, right? So she taught the children about the deforestation of the rainforest. And she talked about the animals that are going extinct in the rainforest because they're losing their habitat. And when I came in with two people usually go with me, it's a lot of work, and it's more than one person can handle. So we went into the classroom and we brought a whole lesson on the rainforest and deforestation. And the last thing that we did was we read a book called There's a Rantan in My Bedroom. And it's about a little girl. If anybody wants to look it up, go to YouTube. You can find it. It's a 2-minute story. It's a baby story. It's what I told these are 4th and 5th graders that we work with. I said, this is a baby story. There's no big words in here, and it's mostly pictures. It's 2 minutes. We read the story, and it was about a baby orangutan that was in a little girl's room. Maybe the girl was 4 or 5 years old is the way it felt. Maybe she was 6, but not more than that. There's an orangutan in her bedroom, and the orangutan is kind of tearing up her room a little bit. Is mad at her shoes, and he's mad at her cookies, and he doesn't like her chocolate bar, and he's mad at her shampoo, and he's making noise, and he's throwing things around. And at one point, the little girl says, I don't know why you're here. I really want you to leave. I want you to leave. But before you go, tell me why you're in my bedroom. And the orangutan turns to her and says, there's a human in my forest, and I don't know what to do. He's taken my mom. He's taken my dad. I'm afraid he'll take me too. Right?
Wow.
And it shows the picture of, and these are all just hand-drawn pictures, beautiful, beautifully done. It shows like a big excavator in the rainforest, you know, and that the forest is getting devastated. After we read that story, the kids were just like, and I said, there are things you can do. Yes, you're 10 years old. And there are still things you can do to make a difference all over the world. And one of the things is be careful what you choose to eat, because that rainforest is being deforested. The trees are being cut down so that we can grow more cattle, or so that we can grow oil palms, or so that we can grow soybeans to feed cattle, things like that. So you slowing down or not eating animals anymore, beef anymore, could have a big impact on whether or not they keep destroying the rainforest at the rate of a soccer field every minute. That's how fast it's going. By the end of that lesson, I don't think those children really care a heck of a lot about their health. They don't understand that in 45 years they could have a heart attack. But I'm telling you, they were blown away by the fact that they could make a difference in the world. So after that, we had this, whole thing, and we had, some kind of fruit smoothie bowls, and we had a lot of fun. I'm going to say at least there's 25 kids in the class. At least 8 of them came up to me and just wrapped their arms around my waist, put their head like on my chest, and said, Miss Meryl, thank you for coming. Thank you for telling us about this. 3 of them said, I don't think I can eat meat anymore. I can't. That's amazing to me.
Mm-hmm.
That's the kind of stuff that I see children responding to. It's not so much about that they're overweight or they have diabetes. Somehow that doesn't register. They're still invincible at that age,
Mm-hmm. Mm-hmm.
But for them to know that they can make a difference for other animals and for the planet, that really touches the ones I run into anyway.
Mm-hmm.
Seems to be what touches.
I think that's a beautiful story, a beautiful analogy. I'm now equipped with more to be able to share as I'm in situations that will allow. And I think you're right. As far as children, most actually don't really see themselves until somebody points them out. You're this or you're that.
Right.
And most more easily adopt to helping others.
Yes.
I mean, that is our nature. That is, what the human frame was born for, which is why, we used to say it takes a village, well, still do, it takes a village to raise a child. We have had that innate nature to come together for a purpose. And now we just got a new topic.
Mm-hmm.
We've got a new topic of saving our children, saving the planet.
I do want to say, though, that many parents do not tell their children about the animal that they're eating.
Correct.
My daughter, I still remember my daughter was with a very good friend of hers. They were 9 years old. We were driving somewhere. They were sitting in the back of my van, and I remember them talking. And my daughter had just slept at this girl's home over the weekend. And on Sunday, the parents gave the kids bacon and eggs. Of course, my daughter did not eat that. So they didn't really have anything for her. She didn't eat. She waited until she got home.
Oh my goodness.
They didn't have anything for her. And I had told the mother, you can give her some fruit. But apparently they didn't even have anything. So, but the girls were talking when I picked my daughter up to bring them to this activity that day. And I brought my daughter some food then. My daughter was eating, and the girls were talking in the back. And my daughter said to this girl, she said, "Do you know that what you were eating was a pig?" And the girl looked at my daughter and was like in shock. And she said, "What are you talking about?" And she said, "Well, do you know that that bacon you were eating, that was a pig that was killed? It was a dead pig." And that girl said, "It is not. My mother bought that at the supermarket." This is a 9-year-old.
Mm-hmm.
This is not a 3-year-old. This is a 9-year-old who was not told that these animals, these dead animals that suffered and were brutally murdered, that she didn't even know that they were animals.
Right, right. Well, it's clever how we do that, right? So a pig is a live animal, but pork is something else.
Right.
Egg is something else. Bacon is something else, right?
Right.
A cow is a live animal, but beef is something else. A hamburger is something else.
Right.
Ribs are something else, right?
Mm-hmm.
Chicken, okay, we still call chickens chickens, and we still call turkeys turkeys. Fish, we call fish. But we do a lot of little curious word games with our
Mm-hmm.
That's right.
Mm-hmm. It's probably why a lot of kids don't eat fish. They've had fish as pets in bowls, and yeah,
Yeah.
yeah.
It's interesting how the meat industry makes all these names so that people don't have to think about what they're
Right.
eating.
That's right.
Like
Right.
what you said, when people go to the store and they order pork,
That's right.
like they don't think about what that is.
Yeah,
If
prime
they
rib.
say, "Oh, I'll have that pig over there,"
Mhm.
Mm-hmm.
Right. Yeah.
which
I
is
remember when I was a
totally
kid, we
different.
used to see whole animals hanging like in the butcher section of the store,
Yep.
right? See that
Yep.
anymore. It's all sanitized.
Yeah, that's all
Mhm.
done in the slaughterhouse now.
That's right.
Mhm.
It's all
And we're not
sanitized.
allowed in the slaughterhouse.
That's right.
We're
Mhm.
not allowed on factory farms. And
Mhm.
because we're not allowed, if anybody would go into those places and see what happens. I had a woman one time email me telling me that she had passed a slaughterhouse and she had heard the screaming. And she said that it sounded like the screaming of humans.
Right.
And
Oh,
she was so horrified by it that she became vegetarian overnight. So can you imagine going with your child to visit a
yeah,
slaughterhouse?
that would be quite
Yeah,
the class trip, wouldn't it? Let's do that for a class trip. Oh no, we're going
I
to
would
a petting
approve
zoo.
of it because there would be an awakening then.
Yeah.
Oh, for
People
sure.
would definitely start
You
changing.
can go to the petting zoo though, right?
And go on the positive side of it
Yeah, we
and
can go
pet
pet
the
that way.
animal.
Mhm.
Yeah. Yeah.
Wow. Something else.
This is for me what makes this movement so very important. It's, saving our children. I think that the subject of our thing for today, championing children's health, education, empowerment, and advocacy. And you can get education. We can talk about educating the parents and the caregivers and the educators and the group leaders, everybody who is in that space of focused education for children. Well, there's education for parents. And in that education for parents, there's empowering parents, because a lot of parents, well, I don't know how to cook these plant-based foods. I don't know how to cook them or do them raw. It's not something that I was brought up on. And if I was, I'm thinking that they're not going to like it because I talked myself into not really liking it. So the way that I know how to do it, I'm not going to have the best energy in.
Right.
And then, this whole advocacy piece, once we get the education started and really moving in a velocity that creates waking up, that creates the movement that parents and young adults thinking about parenthood will look at. I mean, a lot of young adults have gone vegan or at least plant-based or vegetarian because they saw their grandparents suffering. They saw their parents suffering, didn't really know why until they started asking questions. And then the questions didn't get answered with, did you know there was a solution? And so they're still seeking information. And a lot are saying, I don't want to have kids because I don't want them to experience that.
That's
You know, I'll make sure that I have enough wherewithal that I just get put in a home and that takes care of me. Or the military, like I was telling Meryl,
Yeah.
those who are going in now are really focused on the end game. I'm going in because I know that my future, you know, if something happens to me while I'm in or out, I'm taken care of as far as a place to be buried and a means to get buried. Or cremated, whichever is their will. The military will take care of that for them. So we really want to be in this space of championing children's health, educating and empowering those who impact children. And in that, make that our voice for advocacy, for doing better for our children. Changing legislation across the nation to have plant-based options offered in every school in the country, and really making parents aware that it is an opportunity. One of the things we were talking about was how many people in the state of Illinois know this. And it was so awesome to see Meryl on the local news live as they were talking about the new law that had been passed. Of course, it's at the end of this school year, but that's actually a good time to prepare for next school year because you've got to get your request in before the school year starts in order to make sure your child can have that option when school starts and not wait until after when it's available. Let's make it available across the country in every state. And I just say kudos to the districts, the school districts that have already adopted this, that have already seen positive results from this. And I ask them, share those results. Let us know that you're doing this. Let us know that, you know, the results that you got, how they ended up over time. I think that is key. You know, it's one thing to just say, do something. It's another to say, someone has done it. This is the result. You can do it too.
Right.
I think also it's got to get where the kids are going. They're going on the TVs. They're watching programs. They're watching commercials. They're being indoctrinated. Somehow we have to get this in front of them. We have to get it to parents. We have to get into places where parents go and take their children and start to see loads of plant-based options. And places where they can be educated, where they can go and have a simple class. Like even kids love making simple recipes. I do a program. I haven't done it for a while, but I used to do a program called Raw Food Fun for Families. And I had families come and create recipes with me. And one of the families, I still remember, the father contacted me and he said, I don't know if I should bring my kids because they don't like fruits and vegetables. I don't think they're going to eat anything that you're going to prepare. I said, that's great. Bring them. This is where they need to be. Bring them over. So they came, and let me tell you, I still have videos and pictures of these two kids totally enjoying themselves, preparing the food, not thinking that they're going to eat it because the parents told them, like, if you don't want to eat it, it's okay. Let's just go to prepare. So they came, they had a lot of fun. We took pictures and videos, and they loved that they could see themselves preparing the food. And then afterwards, I had them all out on the table. The other kids were all happy to eat them. These two kids slowly went over to the table. They tried a little bit of each thing, and they each found one or two things that they liked a lot. So I told the father, I said, this is the beginning. You have a couple of things that you can start weaving into your day that they will like and eat every day. And then you can start adding from there.
Right.
And I saw this father at other events later because he and his wife were both interested in changing their own eating habits. So they came to a couple of my programs. And he told me, he said, you know what? Ever since that class, my kids are eating healthier. So it's a
Yay.
matter of getting in front of them, getting the parents to understand how important it is, because they really don't believe that what goes into their mouth, what goes into their kids' bodies is going to make a difference. And if they're not seeing it on TV, if they're seeing all these horrible foods that are being told that they can eat them, and they're being taught in school, and by the way, the schools and the media have a monopoly
Yes.
over what goes out to people. And
Right.
also they're being marketed at the stores. You know that when you shop, that right up by the cash register is all this junk food.
Yep.
Mhm.
You'll grab it up there. Like there's
Right at
marketing.
the front door of the market. Mm-hmm.
It's constant. It's
Mm-hmm.
just constant bombardment. So of course they think it's okay to
Right.
eat that way
Right.
until it's like too late and suddenly you're told that you have a chronic disease.
That's right.
And then you don't know how to deal with it. So of course you're going to go to a doctor, and out of fear, you're going to take whatever medications, and you're still not going to look at going towards a plant-based way of eating.
Well, and I think that again is part of the education, because parents don't realize that there's a thing before the need to go to the doctor. And they don't look at, well, what
What
happened
is
that
that?
got me here,
Mhm.
that I need to go to the doctor, that the doctor is trying to, in their estimation, fix, when we really know it's not the fix. And they don't have that assimilation to go back to the cause. I like one of the things that Dr. Taylor talks about is he was one of those doctors. And he got to the point where he understood what a whole food, plant-based, vegan diet could do in his life as a heart disease survivor. He has become a resurgent physician, meaning that he not only lives in this space of traditional Western medicine, but his focus is on, let's figure out why this is happening. And let's figure that out before I decide what symptom we're going to
Which
address.
doctor is this?
This is Dr. Akil Taher.
Yes, I spoke
He's
with him at that conference that
at the
NHA.
National Health Association conference.
Yeah.
Yeah, yeah. He is part of the American College of Lifestyle Medicine, and he's adamant about this whole piece of education and even championing for our children's health. He's very involved in his grandson's life. And, you know, we
He's
want,
one of our charter members too, don't forget.
yes, yes, he is. He's one of our charter members, and we may be having him come and do something to share his story
Yeah.
and
Yeah.
his feelings around why he joined the Alliance, and, you know, just what this movement is in need of. And it's so important that we get the doctors and the nurses and the other health practitioners. You know, they may not be a doctor or a nurse, but they work in the hospital system or in a doctor's office, and they see this happening.
That's right.
They're dealing with it themselves. That, you know, there's resources that we are for the general public to be able to help them. Like you, Karen, you're helping those parents with their children, and you're part of the Alliance that is this hub of professionals that each one of us are doing our particular things. Meryl going into the schools and, you know, really promoting the lobbying for more of these bills being passed. And I'm doing the same thing. I'm actually the speaker coordinator for the Georgia Veg Fest this year. And we're having doctors and other practitioners, vegan practitioners, come in to talk about their various areas of expertise. And it's really key too that even though a lot of vegans don't eat meat, they're still unhealthy
Oh, yes.
because of the ultra processed
All the
food.
ultra processed stuff.
That is the worst of it. That is the worst. You know what? I could sit here and talk with you two ladies for about 3 more days, but we are at just
We
about,
are over.
yeah,
We
we are
are
well over
over.
our time. So we should probably wrap it up. Um, I will do one round of brief parting comments and then we'll wrap it up. So I'll start. I just want to say, if you can see this, I'll hold it up to the camera. So that is more, let's see, there we go. More plants on plates. That is the logo for the Illinois School Food Project. So it's called More Plants on Plates IL. If you go to moreplantsplatesIL.com, you can find that website. And if you're somebody who's Illinois or you know somebody who's in Illinois with children in the school system, please direct them there. Let them know that plant-based lunches are a thing. By law, it is required. And if the child or the parent requests a plant-based lunch, that they have to receive it in some reasonable amount of time. It might not be that day, let me just say, but it has to happen. So that's what I would like to leave people with. And just, I'm going to work with whoever is interested. Karen, for sure. VLynn, for sure. Anybody else in this alliance that wants to move the child nutrition message forward, we have a home.
We have to see that in every single state.
Yes.
We have to
Yes,
see
we
that.
do.
Yeah. Karen,
Yes,
I'll
we
hand it
do.
off to you.
Yes, please.
Yeah.
Please.
Karen, you have a parting comment you'd like to make?
I just wanted to say that this is a struggle that's been going on for too many years. And we want to just see children growing and thriving. I have been writing books to get out there, and I've gotten messages from parents telling me that it's saved their family's life, their children's life. That one parent wrote to me just a couple days ago and said that he had 2 sick kids, and he's been following my books now since they were really young. They're in their teen years now, and he said they couldn't be healthier. And so a lot of people who don't believe that the food that you give your kids makes a difference, there's so much reason to just move forward and give
Try
your
it.
kids this way. Yeah, and I just wanted to say that for people who do want to learn, I showed my first book, Creating Healthy Children. It's a 500-page book, but it's categorized by table of contents and it's easy to navigate. My readers wanted simple recipes, and they wanted something in color that their kids could recreate themselves, something that would be really attractive for children. And kids love this book, Raw Vegan Recipe Fun for Families. And these books are at my website, superhealthychildren.com. There's also a lot of information on that website, Super Healthy Children. There's some recipes there that you can copy. And this book, some kids have gotten this book, recreated the recipes in it, and done YouTube videos on the recipes.
Nice.
So I'm happy to have kids do that. I don't care. And then I also have my third book is Heal and Prevent Autism, Natural Solutions That Work. This book also has recipes that parents can use, and it talks about the why part and why we've got to move on this, because it works. Plant foods work for autism, for all kinds of mental health issues, from ADD to autism, everything, everything. And my last book that just came out this year is Bye Bye Acne. So for anybody who has skin issues, my subtitle is Clearing 25 Years of Cystic Acne in Just 3 Months. And that is my story. That's what happened to me. I had over 25 years of cystic acne. And when I went to plant foods, specifically giving up dairy, my skin healed in 3 months after 25 years of pain, embarrassment, and suffering. So I tell people, this doesn't have to happen. I could have changed this 25 years ago.
If you'd only known, right?
If I had only known. And so those are books I'm very passionate about. And I think that they've helped a lot of people. I've had some young people also call me who were already having skin issues and read Bye Bye Acne and went vegan overnight. That was huge. And then also getting away from the vegan ultra processed stuff that we've been talking about and going to whole plant foods with a lot of fresh in there, a lot of fresh foods, fruit and veggies.
Yeah. Thanks, Karen. All right, VLynn.
All right, I'm going to make this short and sweet.
Okay.
You know, for me, giving up dairy was something that was the transition in my life in my mid-20s when I was suffering from cystic acne, and thinking I'm doing all the things right. You know, I'm working out, I'm drinking lots of water, I'm doing all of these things, yet still having that issue. And today I look back and say I would not have had, I'm about to be 70 years old, the big 70. I remember thinking when somebody said they were 70, it was like, oh, that is so old, right? And now I'm like, that's me. And I really do feel like I look and feel so much different than what I had seen. It's time for us to rewrite the narrative and to reclaim what we have had all along. We just didn't know it. We had the wool pulled over our eyes.
We can age gracefully.
We can age gracefully. And I want to say very simply, eat more plants, live better, live longer, live healthier, eat more plants.
Yeah. Well, thank you both.
And join the Sage Circle Alliance if you're a professional, a doctor, nurse, fitness instructor, chiropractor.
Coach,
I go down the list. Coach, health coach, nutrition coach.
Right. If you're an author, if you're any
psychologist.
Right. If you are a plant-based entrepreneur, if you are a change maker, a thought leader, an action
influencer.
That's it. Those are the people. Those are our people. You can see scrolling across the bottom of the screen, sagecirclealliance.org. You can go there, look for the join or become a member button, click on that, fill out the form. There's all kinds of levels of membership. You can choose the one that fits best, and we'll be in touch as soon as you do that. You know, you're in the fold, and we'll start working from there. So nice to be with both of you today. Thank you so much.
Same here, ladies.
So nice to be with both of you.
Likewise. All right. That's it. We can go off and do whatever we do on Saturday afternoon.
Have a wonderful rest of your weekend.
That's right. All right.
Thank you so much.
Bye.
We'll see you soon.